UP HealthBreak, brought to you by UP Health System.
A primary care physician takes care of you throughout your lifetime. Dr. David Shahbazi with UP Health System Marquette explains why we should all have a primary care physician.
I think we all need a physician because we all get sick, and we should have someone we can go to that we trust and that knows us. If you see the same doctor who's seen you before and you're coming in for a cough or because you have a stomach ache or a headache, they would have seen you for other things before, and they will be able to connect the dots to what those various symptoms are and figure out that you might have a thyroid condition or have asthma or have some underlying condition that you really didn't realize you had, and only when you see them and they know your history can they put it together. We also should have a primary care physician because there are things we can actively do to prevent ourselves from getting sick later. There are quite a lot of illnesses that we can screen. We can screen for colon cancer. If you get proper screening from colon cancer, you shouldn't get colon cancer. You shouldn't die from colon cancer, which is one of the more common cancers. We can screen people for breast cancer and detect it early and treat it early. We can screen people for diabetes, high blood pressure, a number of other conditions that in general we're at all risk for, but certain people are at higher risk for others. So if your parents had certain illnesses, you might need to be screened for those things. If you're obese, you might need to be screened for those things. So we do a lot of screening for illnesses that people might not be thinking of.
For more information, visit uphealthsystem.com. I'm Kristen Presall.
UP HealthBreak, brought to you by UP Health System.